On over to SuperTalk TV, and here's a cool thing that just happened. A team at the University of Mississippi Medical Center performed 2 catheterized heart repair procedures recently. That's not the big deal, but they did it live to an international conference. And Dr. Ebeid is joining us today, who's the director of Pediatric Cardiac Catheterization Lab there at UMMC, to tell us a little bit more. Hey, Dr. Ebeid.
Hi, Rebecca. How are you?
I'm doing well, and congratulations. I can't imagine doing this, number one, just in general, but then also with a live audience at what you have dubbed as like qualifying for the Olympics to even go to this particular international conference. So how did UMC find itself positioned for something so cool?
Well, this is, as you mentioned, it's really a very big conference. It's probably the most prominent national and international conference for the kind of procedures we do. We do a lot of procedures, very delicate procedures in the cath lab on children and sometimes on adults born with heart conditions. So many centers compete to basically showcase what they do. And I've been attending this conference now for many years, and I've been invited as a speaker and faculty on the panels. And they know what we do here, and course directors asked me this year if I would be interested to show the cases I do. And that's a huge recognition for University of Mississippi at what we do, that we recognize, but this is national and international directors from Ireland, from the United States, from all over, really, the directors themselves. So anyway, we discussed the cases we do and what they know pretty much what I do here. And they asked us to go ahead and show it to the live audience while we are performing the procedures. There was probably more than 800 attendees from all over the world presenting basically creme de la creme of the cath people in the world.
Did it make you nervous? Dr. Ebeid, did it make you a little nervous?
You get a little worried. You want to make sure that you're, number one, the most important thing is you're providing the best care to the patient. That's really the main focus that was in my mind, that the patient. And then having people watching, it wasn't necessarily making me nervous as much as there were questions back and forth, and I'm answering without interrupting what I'm doing. So it was a little unnerving, yes, to say the least.
So in layman's terms, Dr. B, kind of explain what you guys were doing live and why it was something that other people, top level of their field, also would be interested in watching, because obviously it must not be just a routine thing that's done in clinics all over. It has to be a little more specialized for folks to want to be able to witness it or see and learn from it in that unique way.
Yeah, that's an excellent point, because if it was a simple procedure done all over, it wouldn't be worth showing. And some of the procedures we do are quite long, and we have only very limited satellite time to show what we do. So we had to choose something which is reasonable and not very simple. So the 2 procedures I did was, there is a lot of children are born with holes in the heart. The more common holes are in the upper chambers of the heart, and that has become routine. The lower chambers are the ones which are not routine. And this is the one case I showed to how to close the lower chamber holes safely and effectively in the cath lab. Traditionally, this needs open heart surgery. And interesting, when I was showing the case, there was in the panel surgeons, and there were moderators were asking, would you do it surgically? Would you do it in the cath lab? And there were back and forth discussions. And basically, if you can do it safely in the cath lab, most people would say do it, including the surgeon, but the surgeon was kind of like wondering. So yes, it's a very special, delicate procedure. That was the first one. Unfortunately, it went very well. And then the second procedure was sometimes patients require valves in the heart, and these valves may not function. Traditionally, this is done surgically. But there are now new techniques to put the valves in the cath lab, and which is becoming more and more popular. The one unique situation about this specific patient is we placed a valve in this patient approximately 6 years ago, but we intentionally put a relatively large valve to allow us if the valve malfunctioned, to put a second valve inside it. And that was the interesting thing about this patient. I was showing that if you prepare properly, you can put a second valve if the first valve malfunctions. And in this patient, that's exactly what happened. The first valve malfunctioned, but we had things prepared really 6 years ago that if it malfunctions, we can put a second valve without going to open heart surgery. So that was the message for the audience, that if you prepare it properly, you may still avoid surgery, even the original valve, if it's malfunctioned.
I would say anytime you can avoid open heart surgery, Dr. Ebeid, anybody would agree that's a good thing.
You are right.
That is definitely a good thing.
Most definitely, that is correct. Both patients went home the following day. We're not even in intensive care unit. We're just on the regular floor.
Yeah, that's a big improvement. That's a big deal. Brag about UMC's level of expertise. Dr. Ebeid, I know you kind of headed this particular team, but you obviously were not alone, and there had to be a lot of expertise and innovation just on UMC's part here in Mississippi to make this happen. I want folks listening to know that, like, this is cool. This you guys got this invitation right here in Mississippi, and it was telecasted from Mississippi, correct?
That's correct, yes. We had audiovisual crew came from San Diego, actually, to set everything, the monitors, the video, the cameras, and was broadcasted live, yes. You're exactly right. To answer the first part about the UMC is really world-class center. The heart center provides everything there is to be provided anywhere. And actually, there are things we provide are not available even in the United States. We had a procedure maybe a few years ago where we had to bring things from overseas which were unique for this specific patient. And I had the support of every member of the heart center, the cath lab staff, the anesthesia, the directors, the chairman of pediatrics, the director of the co-director of the heart center. Really, there were so many people providing us with everything we need. There are things very expensive that whenever we need it and they recognize that something may help the care of the patients, money has never been an issue. Personnel has never been an issue. So it is really very unique that it's not just me. It's a huge number of people working very closely with me, those who are scrubbed with me to work, those who are providing as I said, the anesthesia, all support, the ICU staff as needed. Fortunately for these patients, we did not need to, but there are so many patients who are prepared to go to the intensive care unit after the procedure.
Super cool, Dr. Ebeid, and I think it's really neat, too, that that's just something going on right here in Mississippi. But I'm interested, what sent you into pediatric cardiology? Of all the things that you could have gone in, what made you want to go work with babies and baby hearts?
That is so interesting question. Well, it really got me fascinated as soon as I started my training with general discipline of pediatric cardiology, how basically the plumbing inside the heart and how things get redirected. Many children, well, not many, but probably 1% of children are born with abnormalities in the heart function or attachments. And most of the time, or some of them would require surgery to redirect things in the right direction. And as I got more and more involved in the pediatric cardiology, I saw what the heart cath can do, that at this point it's replacing a number of heart surgeries. Of course, the heart surgeons do much more complicated procedures, but the more simpler procedures that can be addressed in the cath lab has expanded so much the care for these patients. So it's really, I got fascinated with it. I just could not see myself doing anything else.
Well,
it was just, yeah.
I hope I never see you in your office, Dr. Ebeid, but
right.
If I need you or somebody, listening ends up, family member needs you, we're just glad that we've got world-class medical care here in Mississippi. So again, congratulations to your team and putting Mississippi out there. And yeah, thank you for your time.
Thank you very much. Appreciate that very much. We're all here to help, and just come visit for a social visit.
Will do.
Not have to be clear.
I don't have to be a patient. Thank you.
That's exactly right.
Have a good one, Dr. Ebeid.
You too. Thank you.
All righty. You guys stick with us. We got more for you coming up.